This presentation is on bilingual speech-language pathology programs, and I'm going to focus specifically on Spanish and English bilingual programs in the US. So some background information on bilingual speech-language pathology. So speech-language pathologists who are fluent in a second language are not necessarily qualified to treat individuals with communication disorders in that language. In order for the SLP to be qualified to treat individuals with communications disorders in that language, they should be familiar with a couple of different things. One would be the pattern of language acquisition in the second language, the differing grammatical structure of that language, the pattern of bilingual acquisition, so what it would look like for children who are developing two languages at one time, and typical versus atypical errors in bilingual speakers. To be competent in treating bilingual individuals, SLPs can do one of two things. They can attend a specialized multicultural bilingual program, which is not necessary, although many bilingual speech-language pathologists do attend one of these programs while they're in graduate school. Or you can participate in continuing education to acquire this specialized training. So what makes a program bilingual? I'm going to be looking at 8 different programs, which I separated by geographical region. So 2 in the East Coast, 2 in the Midwest, 2 in the Southwest, and 2 on the West Coast. The common denominator between all of the programs were 2 things, one being specialized coursework, and 2, clinical experiences with bilingual Spanish and English speakers. So on the East Coast, first we're going to be looking at Columbia University. The program is the Teachers College Bilingual Extension Institute, and the certificate that they would earn is called the Advanced Certificate in Bilingual Speech Pathology. So this Bilingual Extension Institute is specifically for speech-language pathologists who are already practicing, or for graduate students at other universities other than the Columbia University. For students at Columbia, this specialized training is already a part of their graduate program, so they wouldn't need to enroll in the Extension Institute. So since this is for students who do not attend Columbia University, there are 2 formats available. There's an on-campus or an online format, and they are taught by an 8-person faculty and 7 master clinicians. It aims to provide students with the knowledge and clinical skills needed to provide culturally and linguistically appropriate services for children and adolescents. The Bilingual Extension Institute, as I said before, is for practicing bilingual SLPs who already received or are currently completing their master's degree from other universities. And this program at Columbia focuses specifically on children and adolescents. So when we look at these 8 different programs, we will see that some of them are aimed specifically toward treating bilingual children and adolescents, and others are for working more with all ages. So the program requirements would be the completion of 6 graduate level credits, which is 2 courses. The 2 courses are focused on assessment and treatment for preschool and school-age children. The admissions requirements would be to complete an online application, which can be found on the Teachers College website, submitting a statement of purpose and academic transcripts, and the applicant must indicate the non-English language for which they intend to provide services. So another thing that we will see when looking at the different programs is that some of them are for specifically for bilingual Spanish-English speakers, and others are bilingual as in you can choose the language, your second language. So at Columbia, you would indicate the non-English language. The next university is University of North Carolina at Chapel Hill. The thing about North Carolina is a little bit different from the other programs here is that they do not offer a track or certificate within their SLP program. Students instead choose from a variety of electives. So the opportunities that they do have for bilingual students, one opportunity is that they offer a certificate in Latin American Studies, and this can be combined with any graduate degree at UNC. It would require the student to have proficiency in Spanish. It also requires a research project and a paper with Latin American content, and then the student would also need to take 4 graduate level courses. So 2 would be through the speech and hearing department, which is one, an independent study, which I'll talk a little bit about on the next slide, and also a community-based learning experience, which I'll also talk about on the next slide, and then 2 additional courses outside of the speech and hearing department that are related to Latin American content. So some of the other opportunities at UNC include they have bilingual master clinicians available to supervise clinical experiences in early intervention schools and hospitals. Students can complete an independent study elective that includes general readings regarding serving bilingual populations, along with a topic of specific interest to the student. So an example of this would be aphasia in bilinguals or phonology in bilinguals. And then UNC also offers a service learning trip to Guatemala during the summer and an annual bilingual conference. Moving on to the Midwest, first we will look at Marquette University. Their program is called the Bilingual English-Spanish Specialization. This specialization program prepares speech-language pathologists who have proficiency in Spanish to evaluate and treat communication disorders in Spanish and bilingual Spanish-English speakers. So the requirements for this specialization would be the completion of 4 academic courses along with 50 clinical hours working with Spanish or bilingual speakers. So at Marquette, we see here that it is specific to English and Spanish. The 4 required courses are Spanish phonetics and applied linguistics, multicultural issues for the speech-language pathologist, speech and language assessment in bilingual populations, speech and language intervention in bilingual populations. The admissions requirements, so the applicants must first be accepted into the master's program at Marquette. They will answer questions about the specialization on their CSD application if they wish to participate and be considered for admission. And then they should also take a Spanish proficiency test. The one that Marquette wants students to take is the ACTFL OPI. Moving on to Indiana University Bloomington, their program is called Speech Therapy Education, Practicum, and Services for Latino Children and Families. So here we see a contrast from Columbia and Marquette, just from Marquette, and similar to Columbia with serving specifically Latino children. So this program prepares students to provide speech-language services to young Latinos and their families, particularly in the public school setting. STEPS is a research-based academic training which includes 2 courses that focus on serving Latino children and their parents. It also includes clinical field experiences with Latino children and families, and also a service learning component within these academic and clinical training requirements. And in addition to this, students are required to participate in clinical grand rounds with fellow students, alumni, and also faculty, in which they would discuss things they're doing as bilingual speech pathologists and also current research in the field. There are 2 required courses at Indiana: Spanish Language Acquisition and Disorders, and Child Dual Language Learners, Development Assessment and Intervention. Admissions requirements would be minimum of a 3.0 GPA, fluency in Spanish, when they want a minimum of low advanced fluency in listening and speaking. The desire to work as a bilingual SLP with children and adolescents ages 3 to 21, and finally a phone interview to assess the oral language proficiency in Spanish. Southwest, first we will look at University of Texas, Austin. The program is a bilingual and multicultural certificate. It fosters the development of competencies required for serving bilingual individuals with communication disorders. It provides academic support in order for students to acquire knowledge of language development disorders and culturally and linguistically appropriate service provision, for the bilingual population through staffings and specialized coursework. The requirements, so a little bit different from Marquette in Indiana, is that at Texas, at the University of Texas, it would be after you've already been admitted to the program, would you express your interest. So it's not a part of the application process. You declare interest during the new graduate student orientation. There are 6 credits of specialized coursework that students would need to take, and they need to be selected from the following, which is language theory and bilingualism, collaborative models of assessment and intervention for bilingual children, and then also an outside upper division or graduate elective in bilingualism. So here we see 125 hours of bilingual clinical experience, which is significantly more than Marquette, which was 50 hours of bilingual clinical experience, and then also a passing score on an oral proficiency test at the advanced mid-level. And the University of Arizona. So the University of Arizona is a little bit different. It is not specific to Spanish speakers. So the ones we've seen that are specific to Spanish speakers were Marquette, Indiana, and the University of Texas. And University of Arizona is more like Columbia, where you are not, it's not specific to Spanish. Another thing about the University of Arizona is that it is open to both monolingual and bilingual students, so you do not need to have second language proficiency. And you also would learn how to implement the use of interpreters here. So this program allows students to specialize in evidence-based methods of assessment, diagnosis, and treatment of bilingual children and adults with speech, language, and hearing impairments. Students learn how to appropriate, assess, and treat all languages in the bilingual individuals. There are 9, the required courses needs to be 9 credits of the following: bilingualism, multiculturalism, and non-mainstream dialects, workshop in topics and service delivery for bilingual populations, additional graduate elective course outside or within the department relating to phonetics, bilingualism, or multiculturalism, and then a bilingual clinical practicum supervised by a bilingual speech language clinician for clinical placements with culturally and linguistically diverse populations. On the West Coast, San Diego State University, it's a bilingual speech-language pathology specialization and certificate. So at San Diego State, it is also specific to Spanish-English bilinguals. It provides in-depth course content on bilingual development and disorders across the lifespan, and a variety of research experience with bilingual populations. The goal is to develop the theoretical knowledge and clinical skills needed to address disorders in the bilingual population and to prepare students, bilingual students, to practice in a variety of settings across the lifespan. The requirements would be a minimum of 100 clinical practicum hours with bilingual clients. This can be through clinical internships at hospitals, school settings, and clinical labs. And the completion of 13 units, which would be 9 units of coursework and then 4 units of the graduate clinical practicum. The admissions requirements are students should complete a Spanish proficiency test. They should complete the certificate application form as well as an essay, and then there will also be a meeting with the applicant to discuss the application and essay with the applicant. Finally, Portland State University, and they have a bilingual concentration. Right now it's specific to English and Spanish, but on their website they said that that is specifically due to the fact that that is just the expertise that their faculty has right now is in Spanish. The bilingual concentration provides graduate students who have proficient Spanish language skills with clinical research and academic training to work as bilingual speech-language pathologists. An interesting thing about Portland State University is that they actually have an education abroad opportunity in Ecuador for their students, which is a 6-week program. The requirements at Portland State are Students will focus their elective requirements and culminating experience on topics related to bilingualism, the completion of 2 courses on bilingualism. So this is an additional 2 credits past the master's degree, and then a culminating experience on an improved topic relating to bilingualism, and a presentation on bilingualism are also required. On a bilingualism topic of their choice is also required. So there will be 2 practicum sites and 125 hours of clinical observation. So their clinical observation is typically completed at the bilingual clinic on campus or at a community externship. And also, similar to Indiana University, is a community service component. So students will complete 20 hours of service, and these service hours can include volunteer work such as bilingual material development and support for Portland State projects related to bilingualism. And the admissions requirements, so first you must be accepted into the master's degree program, and then there'll be an application for the concentration, and then you need to be able to demonstrate your Spanish proficiency, and this can be done through a review of your transcript and also an interview with the faculty member. So finally, I did my personal ranking of the programs, which I based off of what I would personally want to attend, but also just after reviewing all of the websites and learning about the different programs. So I put the number 1 program as San Diego State University. And going back to the San Diego page, what I liked about San Diego State University, one, that it was specific to Spanish, the Spanish English speaking population, but that they really focus on their coursework, and it is like an in-depth. They provide in-depth coursework, and I also like that it's not specific to children, that it is for working across the lifespan. Also, I'd say for my second school, I would put Portland State University. What I liked about Portland State was that, one, that they had the education abroad opportunity, which I thought was interesting. And they also had the service learning component, and then that it was specific to Spanish again. These 2 also had their websites were probably more developed than the other ones, and I just think that these schools were, in terms of being accepted into the program, there's a little bit more you have to do, like in terms of like an interview and such, which I think is a good thing to do. For the next 2, I ranked Marquette University and University of Texas, Austin. I'd say the ranking on those are pretty interchangeable. Both of those programs are pretty similar. University of Texas requires a little bit more clinical observation, but I think those would be very good programs to attend. Pretty similar, though, on where I would rank them. Indiana I put next just because they do while it is obviously a very well-developed program and it has won an award, I just didn't like that it was focusing specifically on children, but I do think that it is a really good program still. It's just focusing specifically on the public schools in Indiana, whereas some of the other schools I think would give you an opportunity to learn more about working with across the lifespan and also in areas other than the public school system. Next, I put Columbia University, which I think is really cool because you can attend this if you don't go to Columbia University. Why I ranked it a little bit lower was just because there was no clinical experience component to it, which I think is a little bit strange, but so it's mostly just the courses, but also is an affordable program that anyone could do, which is very interesting. And then finally, I ranked the University of Arizona just lower because it was, I guess for me personally, I would prefer to attend a university, one specific to Spanish English, the Spanish English population, Spanish English bilingual population, but also I wouldn't be using an interpreter. So this is more for people who want to work with different cultures, who don't necessarily speak a second language. And then finally, I rank the University of North Carolina. While they do have opportunities available for bilingual students, just the fact that there is no certificate available and it's not exactly well developed yet is why I ranked it lower. And that is my review of 8 different bilingual speech-language pathology programs in the US.